Hey guys, so this is a really important training on getting whole families under care. So these workshops are designed to get entire families to sign up for exams and to move forward with care. This is something that I have done over and over in my practice and taught lots of associates and other doctors on how to do. And so I'm going to be covering some really important key principles, strategies, and communications on how best to do this because there is a very real threat of even though you may schedule a whole family, you might lose that entire family, and that should never ever happen. Okay, realize that workshop uh, new patients that sign up for exams, you should be having an extremely high conversion rate with them. I had a 90% conversion rate with these people, and my associates were in the high 80s, and that's because it has to do a lot with the types of communication and training and systems that are in place at day one and day two to convert these people. So super important that you follow these recommendations if you're looking to schedule whole families and convert them, and especially if you're having any challenges converting those families. So let's dive into it. So number one thing to always remember is that there needs to be the awareness of a hierarchy of perceived needs. So what does that mean? It means that when people schedule exams, when they come to workshops, they have a perceived need for typically one person, unless it's a family at the event, parents, and they have two kids who both have really intense, neurodevelopmental challenges, for example, right? So, but most of the time, there's going to be one person who has the highest perceived need, right? So when presenting the cases and the reports and everything, and really going over care plans and getting people to sign up for care, it's important to go from a hierarchy of needs of from high to low, okay, from the biggest needs, and then working your way down to those individuals in the family who may be more like have more like maintenance or wellness type care plans presented because they're not showing high levels of subluxation nervous system interference. So I always want to go back to the primary reason they set up care in the first place, because it's possible when presenting your cases that you might get objections to the entire family going forward with care due to time, cost, various factors. So you always want to make sure you're going back to the reason they set up care in the first place, which we'll go back to in just a moment. When it comes to the first visit, it's important to have this principle of making sure you're not overwhelming them. Okay, so you want to break up the appointments if it's depending upon how many people. So if it's a family of four, I want to break that into two visits. If it's a family of three, in my office, I will do all three new patient exams. But this really comes down to how you feel in your practice. Are you equipped to see three people all at once in a way that's not going to overwhelm them, especially if there's a child with neurodevelopmental concerns, because that visit can become very, very stressful for them and for your team. Right. So break the appointments up into two visits, especially if there's four or more people. And then the next thing is make sure that those, if you are breaking those visits up, that they are preferably on the same day, maybe in the morning, then afternoon, or the back-to-back days, or at most more than you try not to go more than one day in between those visits, right? Because the more time in between the reported findings for the first people who came in and the second people, the higher risk of losing out on that case because of the time involved, and now you're getting into giving half a report for the family. So this is why we recommend having one, break up the appointments and then have them as close as possible. And remember, always be flexible, accommodating, and understanding, right? Especially if you're dealing with families and children with neurodevelopmental challenges, especially, right? There's going to be lots of reasons why we've got to be super flexible, accommodating, and understanding. And so it's important that your team understand that and be that way as well. Otherwise, it's going to leave a bad taste in the mouth of the family, right? They came into the workshop, they were excited, they want to find out. Now they're having, the fact that they scheduled the entire family tells us that you did a great job explaining to them why everyone should get checked, right? By the end of the class, when you've asked them how common you think subluxation is, they're really starting to get it. And you present a family opportunity for everyone to get checked. They're excited. They want to get everyone checked, right? And however, some things can change along the way. right? And so if the visit is stressful, if your first visit paperwork is overwhelming, if all these different things are causing overwhelm, well, that's going to create anxiety and cause people to not be able to move forward and make choices. So be flexible, accommodating, understanding, and really clear on what's next. So now we're assuming we had the first visit. So now we're getting to the reported findings. Key principles here are to make it simple, straightforward, and to provide options, right? It's super important to have easily digestible and accessible care plan options and costs, right? So digestible meaning it's simple. It's you don't have too many different options for them, and having care plans that have percentage differences. When there's two people versus three people versus four people, that all starts to become very confusing. And I find it's best to have really, really simple care plans. We have a care plan template for you that I've used for years that works really well, that is easily digestible and highly accessible in terms of moving forward with care. So let's go over that care plan. Now, this template is available for you in the member area. It's in Canva, so you can make a copy of it. You can change your logo, use it as you like. We have it not just for our family care programs, but also for the other care plans as well. And so the way that I present the report of findings, I'm going to go through a hierarchy of needs, right? Start with the one person they came to learn about where they have the highest perceived need for care. And the first thing I'm going to do is I'm going to go to my individual care plan for, and that's called, in my office, it's called a restorative care plan. That's for an individual having moderate to severe nervous system interference caused by subluxation. You can see that in the member area and see the template. I'm going to go there first, and I'm going to explain that one first and go through one by one each family member and explain what their individual optimal care plan needs are. Now, as I'm starting to go into it, I'm going to say, I'm going to explain what I'm about to do. So I'm going to go over all the recommendations for care based upon what we found on the exam and based upon the consultation history and what we found on that first visit. And so obviously Johnny is having the biggest challenges, and that's what we saw on his scans as well. And so now this care plan right here, our restorative care plan, this is the care plan that we reserve for individuals who have moderate to severe levels of subluxation and nerve interferences, which is what's going on in Johnny's spine here. And so just so you know, before I go over it fully, we do have family care plans that make the care even more accessible and affordable. So I will be going over that in just a moment so you can see that. So I just wanted to let you know that you're going to see the pricing, but this is for an individual. I let them know to bring down the anxiety, that I'm about to go over family care plans that are even more accessible and affordable, because I don't want them to get stuck on just looking at the numbers and seeing that number for the individual and thinking that every single individual is going to need that same amount. I'm stating what I just stated to bring down anxiety around the overall cost. But otherwise, if you don't do that, in their head, they're going to be thinking that, and that's creating anxiety where they can't even really listen to you. They're already shutting down, right? So we start by prefacing it that way. We show them what each individual's care plan needs are, what would be optimal. And so then we've done all that. We've gone through the family. Now we're getting ready to present the family care program. And so I have this on a tablet too, so I can simply just swipe in between files and go to this one now. And so I say now, as I mentioned, we value taking care of families in this office. And so that's why we have family care programs to make the care even more accessible and affordable. And so here's our various options. Now, the thing to remember, right, is my job is to let you know exactly what would be optimal for each individual and then come up with a program for the family. Now realize this is that when we take care of whole families, there's actually a synergistic effect, meaning that when we take care of the entire family unit, every single visit, we're removing that stress and interference. We're resetting your nervous system so that every time you leave here, you're leaving in a state of less stress, more optimal health and function. And so what that does is it lightens the load on everyone and brings the entire family up in a synergistic way. Right? And that's why we really encourage whole families to get under care, because let's face it, the situation you guys have been experiencing is extremely stressful, not just for Johnny, but for the entire family, right? Mom and dad, of course, for you guys, but also for Johnny's siblings, right? And so what this does is it's resetting everybody and letting the whole family breathe, so that now we're in a place of optimal healing, and that actually accelerates Johnny's progress as well. So because of that, even, I'm going to let you know what the optimal number of visits are. However, if we were able to do, a number that was, maybe it's not optimal, but it's close, we're still going to be moving forward, right? And so when we look at your family's unique optimal needs, really it's going to be based upon Johnny, mom, dad, and Sylvia. Then we're looking at a total of 175 visits over the course of the year, right, for that corrective care plan. Now, again, realize that if we were able to do 150, then we'd absolutely be moving forward as well. And so really what it comes down to is what is going to make most sense for the family in terms of time, distance, finances, and that's where my job then is to help to manage those visits, to make sure we allocate them appropriately so that you guys are all moving forward. Because the last thing I'd want to see is where we start deciding not to include one of the family members. I'd rather see us use those visits and get those visits dispersed in a way that's going to bring everybody up in a synergistic way. So based upon how quickly you're looking to move forward and get the results you guys are looking for, which of the care plans do you think makes most sense to you? And then you just be quiet, right? Let them look at it, let them discuss amongst themselves. Usually, ideally it's going to be both, mom and dad there in that moment. And they're going to look. And when you do it that way, you're giving them an option. If you look at this care plan, it's using some of those principles. It's very simple, right? We just have the number of visits right there: 100, 120, 135, 150, 175, 200. Also, that custom plans are available. It mentions that. Then we have the 12 monthly payments, right? So now, because what people need to see is that number, because people base their lives on monthly payments, right? That's how they, cell phones, gym memberships, everything is on a monthly basis. And so that's what I recommend, and what I've been doing for years, and have a very, very high conversion rate doing it this manner, having a simple plan, right? A lot of plans become too confusing when there's way too many decisions to make. If we add the next person, then it's 20% off, and then the next person, that person has 33% off. And I've seen all these different things. This just has the number of visits, the monthly payment, and then the discount, so that they can visually see. I do give a bigger discount on my highest plans there to keep it under a certain amount there. And then the next principle is giving them options, right? So that they know that if they, even though the optimal will be 175, if they picked 150, they're absolutely going to be moving forward, and everyone's going to be moving forward, right? So those are the principles that lead to more families signing up and saying yes to care. Okay, so begin to implement that. Now, let's imagine that you get some pushback and get some objections, right? Because some people, due to very real financial concerns, may not be able to do that. They may not be able to start there, right? And so that's when we want to really explore. First, again, if we go back to other trainings on objections, realize that financial objections we need to look at them as a smoke screen for lack of certainty. Okay, most financial objections are a lack of certainty. If they believe that you could absolutely produce amazing results in their lives and it'd be transformative for the family, if they knew how powerful it could be, then the financial concerns are going to be less and less, right? If they just knew how powerful it was going to be for them. So the first thing we want to do is to make sure and say, if you do get a objection and it's financial, then or even time, you want to make sure. So because they're going to give you different types of objections potentially. Say, hey, Mary, totally understand. Be in agreement, right? Totally understand. Of course, other families often have those similar challenges and need to look at other options, right? And so before we discuss that, though, I just want to make sure, does the idea make sense that in terms of the frequency, and looking at Johnny's scans and mom's and Sally's and dad's in terms of, why Johnny, has the biggest needs, and we need to see him twice a week for the first 24 weeks. And we're doing the progress exams every 12 to 14 visits. Does the process and idea make sense in terms of correcting those neurological and structural imbalances so that we can start to bring about a new normal and correct that interference? Does that process make sense? Right. So you're getting agreement around the idea and the process, right? Is there certainty around that? Do they have certainty in that? And if they do have certainty there, and it truly is financial or time or some other true objection, that's a real objection, then they're going to say, oh yeah, no, that makes total sense, because they want the thing that makes sense. But due to time or finances or some other factors, they're saying they can't do it. Right. And now, but if they really believe in you, they have a certainty in you and the product and the service, then they will say, oh yeah, no, it makes total sense. If they don't, they're going to hem and haw a little bit. They're going to say, oh yeah, no, that makes sense. Right? And you're going to hear it in their tone and their body, and see it in their body language. So if you get that type of objection, you need to go back to square one and start to, go back to that and to certainty around you and things like, hey, Mary, like I totally understand that these, there's can be lack of certainty on what to do next, right? And there's so many different options for the family. And so I just for a moment, just like to reintroduce myself, right? I'm Dr. Steve Tullius. I've been in practice 23 years. I've been helping families like yours, overcome challenges like these for the last decade, right? And countless families. And in fact, we just saw the child last week with very same, with same and similar challenges to Johnny here. And they started coming in 3 months ago. They came to a workshop, started coming 3 months ago, and things are massively different for them. Right, school, he's doing so much better. He's sleeping at night. He's doing all these things, all the things that he wasn't doing that you guys want to see for Johnny. And so I would just hate to see you guys miss out on that opportunity. And so I just wanted to make sure that it's clear that this is what we do in this office all day long, and we got this for you and your family. Does that make sense to you? Like, are you getting that? Right. So go back to create that certainty around you and your expertise, that you do this all day long, that this is your bread and butter, right? So that they have that certainty. Now, let's imagine it's a true objection around finances. We have to go back to the principles of hierarchy of needs and never let them leave without that one person they came to learn about getting the care that they desperately need and want. Okay, we have to have that at our core, right? In our communications and in our body language and everything we do. So the first thing to do in a family is typically go to, usually they're coming in for a child. Maybe they're coming in for mom or dad first, but usually they're coming more for a child. So go back to, hey, Mary, totally get it. Families obviously need to sometimes start at different levels of care in the practice. And so here's what I suggest. Here's what I recommend is that we start with you and Johnny, right? Because looking at your scans, we see that your system, and this is not surprising because we see this all the time with moms, is that your system is massively stressed as well. Right. And so obviously, because you're doing so much for Johnny, you're the primary caregiver, you're there at the appointments, you're doing all this stuff, and unfortunately your needs often come last. Right. And I've seen it time and time again when that happens. When Johnny's doing better, let's assume we just start taking care of Johnny only, is that when Johnny's doing better, your health will start to suffer more and more. And I'd hate to see that happen. And so let's do this. Let's start with you and Johnny. And so that would be 120 visits, right, for the two of you over the course of the next 12 months, right? And even 100 visits would be massively powerful. Even if we were able to see you every other week instead of once a week initially, right? Just imagine what would happen as we start to lift that stress and burden off of both of you. Imagine what life would look like. How does that sound to you? Right, so we paint a picture of that. We lean into the pain and the fact that what we do see when the moms aren't under care and what happens. So we lean into all that. Now you might get a real financial objection from there. All right. So now we go back to the principles. All right. And hey, I get it. Sometimes we need to start there. Okay. So let's do this. Obviously, you guys came here to learn about Johnny and how we can help him. You scheduled the exam because it was clear in your minds and hearts that this was the next thing to find out in his journey. And we see clearly on x-rays, on the scans, that he's having massive stress, right? And so let's start there, right? And then what most families do, because that's what many families do when they need to make those kind of choices, is that as Johnny's getting better, then other families start to jump on too. As we're going through the care plan, many of those families, then mom starts care or dad, or at the end of this care plan, that's when it's time for the next family member or all the rest of the family members to begin their care process. Because the last thing I'd hate to see is that all those reasons you came into that class and into this office to get solved, I'd hate to see those things not get addressed, when it's right here waiting for you. How's that sound? So when you do that, at that point, 99% of the people are going to say yes, right? They just in their minds, they couldn't wrap, whether it was real or mental, around the higher price point for the full family under care. They weren't ready for whatever reason. After you've made sure that those, objections around certainty have been addressed, now you go to that, and that should ensure that at very least that one person they came to learn about is starting care. Okay, so apply these principles and strategies and communications. I encourage you to utilize a very simple care plan like this. It's in the members area, and I guarantee you will absolutely see more families sign up for care. All right, thanks so much.